Our next speaker is Dr. Thomas Kim. Dr. Kim is a practicing psychiatrist here in Austin and is a principal for AGMP Telehealth, offering clinical and consulting telehealth services. Dr. Kim has devoted his professional life to realizing a value-based approach to telehealth in caring for a wide-ranging number of vulnerable populations in high-need environments. And just on a personal note, I want to say that Dr. Kim, during the pandemic, our Safe Harbor Counseling Program has offered urgent psychiatric care for folks who need more than talk therapy. And Dr. Kim has been one of the volunteers who has really helped us out quite a bit with some issues that we needed addressing with a psychiatry colleague. So at this point, I will turn this over to Dr. Kim to begin your speech, and thanks so much for being with us today.
Of course. Good morning. I would like to thank the TCMS Physician Wellness Program and Dr. Sayers for inviting me to participate in this symposium and the rare opportunity to dress like a grown-up because it's been some time. This invitation followed a recent podcast I did for the TMA exploring physician wellness in the time of COVID. And today, I'd like to share some thoughts around the notion of worry. And you'll permit me, and I hope you'll understand, I'm using a new presentation tool, and I hope it goes well. Let's see here. So, while the circumstances of coming together, as previously mentioned, can impact a robust back and forth, that's exactly what I hope to inspire. And I invite you to post comments and questions in the chat feature, and I would be delighted to explore those at the end of my talk. So please permit me to introduce myself just a bit more. My name is Thomas Kim. Please call me Tom. And as I trained for becoming an internist and a psychiatrist, the reason I did that was because I couldn't quite see how you could take care of the mind without tending to the body and vice versa. Since my training, I've been incredibly grateful to have immersed myself in the field of telehealth, which is essentially seeking to leverage technology towards the development of better models of care, because I do believe that we can do better. I'm a self-identified geek. I love video games, comics, pop culture. I can speak endlessly on these topics. And I believe that it's a large part of why I'm able to retain my sanity. I married the best person that I know, Catherine, and together we have a 7th grade quarantine, John Paul, who is equal parts awesome and exasperating. And for those who do know me, they're often surprised to learn that I was actually born an introvert and have spent much of my adult life practicing the skills of an extrovert. Probably because I've always been curious about the minority opinion or the other side of any sort of idea or issue. And what I'm effectively seeking, I guess, is what Justice Holmes described as simplicity on the other side of complexity. So to put it simply, if I were to encapsulate everything that I am today, I would say that I'm worried. What I mean by that is that I worry about the effectiveness of my default coping strategy, which is, as an immigrant father's lesson to his son, of Asian stoicism and persistently high expectations. I can attest to the fact that this can oftentimes be less than helpful. I also worry about my son, who is growing up in these incredibly uncertain times, fully acknowledging that despite the fact that I finished the 26th grade, I am a terrible middle school teacher and desperately need help to help support my son in getting the education that he needs. I also worry about this social experiment of ours with wholesale abandonment of civil discourse and increased polarization everywhere. This does not seem to be a sustainable situation for us. And I worry about the challenge of our constant, yet somehow always shifting state of crisis amid all this uncertainty. And I find myself wondering, how can I best support my patients experiencing a significant level of distress through these times? Though the idea of how questions always reminds me of something I learned from Viktor Frankl, that having a clear why can sometimes help us face all of the how questions. And I also worry that the lessons that I've learned from my father and my personal experiences reinforce this idea that I and we are owed nothing, which can be a bit of a downer. And though Frankl states that there will always be pain and suffering in our life, what might we do with this knowledge? And I'm going to speak more about that in a bit. I'd like to sort of walk us through this idea of the power of worry in 3 parts. The first part is looking at power, little p, and of big W, worry. And it starts with the words that we use. Words are important. And I chose the word worry to describe the pandemic distress that we all are experiencing for a number of reasons. An obvious alternative word would have been anxiety, but I find that it's actually too clinical, and sometimes it can be unhelpful. Stress is another fair word choice that we might be able to use, but stress is too nonspecific and external to ourselves, such as work stress or some other form of stress. And because of that externality, it tends to limit the control that we might have over it. So I submit that worry best characterizes what I believe that we're all internally experiencing right now. Another word to consider is abnormal. And this brings up the potential utility of using the DSM to better understand our distress. There was a recent New York Times op-ed by Dr. Richard Friedman that was titled, "Are you depressed or just bored?" I very much liked his minority opinion that we may not want to be too quick to name the distress that we see and feel, because when we consider this pandemic distress, am I anxious, panicked, traumatized, depressed, perhaps I'm bipolar, or maybe even alcoholic? As you can see, the DSM is useful to academics and payers seeking to confirm that what's seen in one instance is comparable to another instance in time. But clinically, I find that diagnoses have a tendency to slap this label of abnormal onto people, which ultimately distracts from meaningful understanding of this distress. So that said, unquestionably, there is a growing distress everywhere we look. There's increased reported symptoms of mood and anxiety. Alcohol use is on the rise, and there are a number of other markers that we see in the popular press. And I'm constantly fielding this question from journalists who are sort of asking me to explain or sort of lend some insight into what appears to be just an increasing disaster. But I always pause and ask, is this the proper form of the question? Because before we try to answer that, there is real concern about what the ultimate cost of pandemic distress might be. As you likely know, there's a compelling body of research around the stress response and how the HPA axis or fight or flight response is being hijacked, and that's not good. Because when we have persisting levels of cortisol, the negative levels on our brain chemistry and our global health can be devastating. So let's next turn to the idea of power, big P, of little w worry. And what we know that for many of us, that worry is effectively suffering, and suffering can be likened to pain. But pain alerts us to danger. Pain can help us avoid death or dismemberment, and pain is actually protects us, and ultimately it's not something to be avoided. So is there not a place for pain and suffering within this notion of my least favorite word, which is normal? And I think so, because when you consider the status quo and the inertia that we all feel in life, that this risks us being that proverbial frog in the pot of boiling water. True, meaningful, positive change kind of demands that we suffer. So we can draw power from the fact that we all worry about the fact that we're flawed, that we're vulnerable, that we're not enough, or a failure. But without that worry, we would be so unaware of these things that we would be incapable of doing anything about it. So by recognizing the big P power of little w worry, we can be unburdened. We can discover strength reserves that we previously were completely unaware of. We can surprise ourselves on what's possible. And in doing so, we then mitigate the stress response. We cultivate resilience, and we survive and perhaps even thrive in the life that we choose to live. So next up is, this leads to the big P power of big W worry, putting this understanding towards some sort of meaningful work for ourselves in our life. And it begins with this notion of truth. And when we consider the underlying precepts or truths laid out by Viktor Frankl in A Man's Search for Meaning, a book that I highly recommend that you all read if you haven't done so already, that he was actually borrowing from the Four Noble Truths of Buddhism. The first truth is that life is suffering. And the second is that there is a cause for our suffering. The third is that there is an end to this suffering. And the fourth noble truth is that the end requires choice, which they actually call the Eightfold Path. But even if you don't subscribe to this belief system, you might agree that when you take the good, you take the bad, you take them both, and there you have the facts of life. Fair warning, I told you I was a geek. But if you needed further proof, the lyrics to that show were written by a kind of psychiatric colleague of mine, Dr. Jason Seaver, who you may also know as Alan Thicke. But more to the point, recognition of suffering as part of a normal life and worry as a protective alert system basically constructs a positive cognitive reframing, and that this allows us to accept our vulnerabilities. It permits us to exercise accountable choice. And ultimately, what's important sometimes, and ultimately it helps us find what's important, which is sometimes called the best version of ourselves. And to borrow from a patient of mine who recently sort of went through this recognition of himself, flaws and all, he actually described this recognition as a gift of the pandemic, which is to say that were it not for the chaos, the pain, the suffering that he had been going through during this uncertain time, that he would never have gotten to this sort of level of insight. So now that we've sort of gotten to this refined sense of normalcy, I'm often asked by patients, friends, even myself, but how exactly do you change? And there are in fact a variety of approaches. It's what makes me an unusual psychiatrist in the sense that I'm a huge advocate for therapy, which broadly should be probably renamed skill building. And so one example is right now I'm reading a book called Mini Habits by Stephen Geis with my son. The writer discovered that when he challenged himself to do one push-up every day, a curious thing happened. He forged a positive habit that went far beyond just one push-up. And making an intention ridiculously simple is a great way to push past your own inertia and cultivate positive adaptive behaviors. And so just like exercise or weight management, lasting positive growth comes incrementally, almost like a surprise. A final thought on the power of worry for those who might be worried about being unable to find their best self in the midst of all of these worst circumstances is to not be too hard on yourself. One of the lessons of my father that I missed as a child was the value of extending grace to yourself and those around you. And so let's turn to you. In trying to digest everything that's sort of going, I've presented thus far, now it's your turn. I encourage you to define yourself with the ultimate goal of truly accepting yourself, whatever it is that you might find. I recommend that you try to identify your current coping reactions to worry and distress, or perhaps you find that you don't actually have any. And instead, develop more positive responses, which will require a great deal of practice in order to habituate that response, but it actually starts with one push-up. You could begin by asking, what do you worry about? For yourself, for those you care about, for everyone else, and whether you are driving or being driven forward. And depending on what you find in those sort of wonderings, are you okay with where this is taking you? I want to really thank everyone for their time and attention. If you should have follow-up questions or ever wanted to talk about the idea of worry, you are always welcome to email me at thomas@agmp.co. I want to once again thank Dr. Sayers, Chantel, the entire PWP for doing just such an extraordinary job at helping us to care for ourselves. Thank you so much for your time.